The toxic drug crisis continues to wreak havoc here in BC. Just today, BC's chief coroner released a report stating that 206 people lost their lives just in April. Joining me today is Tracy Letts. Tracy, you're with Mom Stop the Harm. Tell me about your organization and what you do there.
Hi, Mom Stop the Harm is a network of Canadian families who have suffered harms in regards to toxic drug supply, bad drug policy, and fatalities that come with that.
So obviously mothers that have lost loved ones and fathers including, you've also been affected by this crisis yourself?
I have been. I've been affected in many ways, whether it's supporting those that have lost a loved one or just people that I know, people in my friends group, my children's friends group have lost people that they love.
It's obvious with the numbers. I mean, we were averaging 6 people a day dying. Now we're up to 7. What can be done to stop this crisis, Tracy, in your opinion?
Well, first and foremost, I think what we really need to do is look at getting a real safe supply put in place for those that need it. And, that requires an exemption from Health Canada. And I think that all governments, nonpartisanly, should be working towards that. That's the first thing out of the gate that I think would start to save lives. Then we have to look at recovery options, but they go hand in hand, recovery and a safe supply. You can't have one without the other because we don't have the availability in the recovery options right now, but a safe supply will keep people alive till we get there.
We've heard that over and over. I mean, I've been covering this issue for literally years now. It feels that, once someone's ready to go to detox, they go to detox, but then they got to wait to go into treatment. And then there's sometimes a time delay. By then, they're back on the streets using again. What is the perfect example of what should happen here?
I think what we need right out of the gate is on-demand detox and recovery options. So if you do get into detox, you do your 4, 5 to 6 day program, but then there's somewhere for you to go right away. And that place that you can go is, kind of matches your unique needs because everybody has different needs and what recovery means to them. And it's just we need that continuum all the way through. So once you've done your program, we also need to look at housing, for those that were previously unhoused, because you can't take people and put them right back in the situation they were and expect success.
Absolutely, and many people are saying, well, it's Russian roulette if you're using now, because right now 8 out of 10 parts that they're testing has fentanyl or benzo in it. What else can be done to help this crisis, in your opinion?
I think too, just stigma and within the communities, if we can really look at what's going on and get voters on board. I think this has become a really partisan issue when we actually need all the minds working towards this. We need it to be a nonpartisan, health-related issue and not a political one, and that's what it's turning into.
And finally, do you have any advice for parents out there that have a loved one that are dealing with addiction right now?
I think the first thing is to educate yourself. We really live with inherent bias when it comes to addiction and substance use, but educate yourself. And there is a lot of support groups out there, so that's, reach out and get help for yourself so you can help support those that are using.
Tracy Letts from Mom Stop the Harm, thank you so much for joining us today. We really appreciate you and all your work.
Yeah,
thank you very much. Back to you in studio.